Hey, what's up? Barnaby here with another Hellolife moment with paper in hand because, Doc, we've got so many questions from people who have tapped into this smart living network known as Hellolife.net with questions for you, Dr. Jeffrey Chamberlain, family medicine specialist. And we've been going deep into anxiety disorders recently, and there's a whole library of information for you to check out in that regard. But this question specifically has to do with a person writing saying, you know, Doc, I feel just perfectly fine at work, and yet once leaving work, going to some place as mundane as a supermarket, suddenly I am in turmoil. Why is it I feel better in certain situations and not in others?
Okay. That's a really great question, and it sounds like this person has a social anxiety disorder or social phobia, and by definition for anxiety disorders, they're irrational. The people are experiencing intense anxiety emotions, but when they stop and think about it, they know, well, I know this isn't a dangerous situation, but I'm really feeling this way. And it can happen in anything. It might be it for this person that going to work is something that they do on a regular basis. It's normal people, it's a normal situation, and so their body's been used to that, where once they go into a new situation, such as a supermarket, they're strangers, it's a big area, they don't know what's going to happen. All of a sudden the anxiety starts setting in, and the phobia starts taking over. And it can be pretty debilitating when this happens.
Well, you mentioned the word irrational, and I think that would be cause for a lot of people not to express that they are having this sort of difficulty, because immediately that tag gets put on them. It's, well, you're thinking irrationally, just think this way, but that's not healthy.
Yeah. It's not healthy. It doesn't help to tell someone, oh, that's irrational, just snap out of it or just do it. That doesn't work, because the person really is experiencing something. These anxieties are real. They're real. There's a chemical imbalance that's causing it, and so it's a real thing that's really being experienced by the person. It's just that the situation itself, the person usually can logically say, well, I know this isn't a dangerous situation,
right,
but this is the way my body responds to it. And so to treat that, you really need to get at the root cause of it, and also to try to get your body used to being in that situation. And that's where therapists who specialize in this sort of thing and do extinction exercises can really help. And really what extinction exercise is practicing being in the situation that causes the problem. Usually it starts off as just being super mundane, like just imagining it, like, okay, let's imagine you're going to the supermarket. And believe it or not, that can cause a lot of anxiety and panic in people who have phobias like this.
The mind is quite powerful.
It is, and so it takes a lot of practice just to be able to imagine yourself in this situation. And then maybe once you're used to, and you've kind of gotten used to imagining yourself in the situation, maybe then it's just going to drive by the supermarket. And that might take a long time for the body to get used to just driving by the supermarket. And basically it's taking a lot of baby steps to gradually get your body used to this, and it helps a lot of people, these types of therapy.
Yeah, I've been working through the fear of the dark with my son, who's 8, and just having him just imagine the things in his room without light. There's a dresser here, the toys are here, and slowly but surely he's getting kind of acclimated to the fact that darkness is just the absence of light, and there's nothing scary there just because there's no light.
Exactly. Fear of the dark is a huge one. That it seems like that's a natural phobia. Fear of darkness, fear of snakes, fear of spiders are natural phobias that people have. And the key is to kind of not let this take over your life or run your life.
Yeah, so when you think about anxiety disorders, it's not just big things in life. It could be very small things, but the big thing is to deal with it, and deal with it quickly.
Exactly. You don't want it to run your life. You don't want it to make it so your life is super complicated or hard because of it. And so the sooner you get help, the better off you're going to be.
Alrighty, and if you have questions still lingering about anxiety disorder, we invite you to just peruse the site. It's here for you. It is Hellolife.net.